Conclude his answer, and I'll call the member for Chisholm.
Thank you, Mr. Speaker. My question is to the Minister for Health. Will the Minister outline to the House how Australia's unique response to the COVID-19 pandemic is helping to protect Australian lives and livelihoods? Is the Minister aware of any alternative approaches?
The Minister for Health.
Thanks very much, Mr. Speaker, and I particularly want to thank the member for Chisholm, who's been a great supporter of mental health in Victoria through the course of the pandemic. And she's been able to do that by looking across,
member for Chifley.
by looking across the world and to see the tragedy that we have faced outside of our borders. As we speak today, 44.4 million people have been diagnosed with COVID. 1.17 million people have officially lost their lives, and no doubt those figures are greater. By the time we conclude at this dispatch box in 2 weeks, when the Parliament meets again, it's likely that those numbers will be over 50 million cases and 1.25 million lives lost. The disease is progressing at a faster rate than ever before. 8 consecutive days of over 400,000 cases, and in the last 24 hours, over 500,000 cases. That means that the challenge the world is facing is growing. Against that background, Australia has had 7 cases within the community in the last 24 hours, 500,000 as opposed to 7. And what that means is that Australia's unique approach has been deeply, fundamentally important in protecting lives and saving lives here. As the Medical Journal of Australia indicated, Australia's approach, our approach, has helped save over 16,000 lives compared with the United Kingdom. But more than that, what we did is, over a long period of time, in 2014 we worked with the COAG Health Council to establish a communicable diseases framework for Australia. That played itself out in over 50 exercises since 2017 for emergency response preparation, involving the National Incident Centre. And that also led the World Health Organization to identify Australia in 2017 as one of the most prepared nations in the world. All of that saw the Australian approach of working together through the AHPPC, the containment and capacity measures, lead to the outcomes that we've had in Australia. And I know there are alternative approaches. There are some who would want a CDC or a Centre for Disease Control. That is the American model. That is the American model, and that is the European model. It's the model which has seen 20... No, it's not actually. I can take you through the errors in that statement. But more significantly, I'll table that afterwards and show you.
Member for Ballarat.
Most significantly, if we look at this, in Italy, 24,000 cases in the last 24 hours. In the UK, 24,000 cases. In France, 36,000 cases. In the United States, 81,000 cases. All of which have gone to the
Minister's
CDC.
time has concluded. Minister's time has concluded.